Thank you, Chair. Thank you all for giving evidence today. It's been really harrowing to listen, and can't imagine what it's been like for you on the ground. You've described the situations to do with the aid blockade, but also the medical supplies as well. I have two questions related. One, what will happen if this blockade remains in place in terms of medical supplies and what that means for people on the ground? And two, what practical measures can the UK now take? We are parliamentarians around this table. What can we push the government for? Dr. Haj Hassan, I'll start with you, perhaps.
I mean, even in March, when there was a so-called ceasefire, I say so-called because at the hospital we were still receiving fresh injured patients from Israeli military violence. But even during that period, the healthcare system was really struggling. We didn't have enough of the supplies that we needed. A lot of the subspecialty services, as I mentioned, weren't available, were being provided with great difficulty. I visited the European Gaza hospital, for example, that had taken over cancer care at the time, and they were struggling to dispose of chemotherapy safely because you need safe equipment to dispose of chemotherapy drugs. I visited the Rantisi pediatric hospital, where some colleagues were trying to set up an intensive care unit, as well as another intensive care unit in a non-governmental hospital, the Patient Friendship Benevolent Society, that's supported by MAP UK. And I heard these pediatricians who provide intensive care in Gaza talk about not having enough ventilators. And when I explored further, it turns out there are 33 ventilators waiting in Israel to enter Gaza. They've been waiting for months, that UNICEF purchased and has been struggling to get them in. I confirmed just 2 weeks ago that those ventilators have still not been allowed into Gaza. These are ventilators for children that would allow us to expand the number of intensive care beds. So this is all, again, during ceasefire period and during a period where aid was initially getting in. These essential medical items were prohibited from entering. Now we're in a situation where the drugs that were used most often when I was in Gaza are now running out of stock. I spoke to the director of pediatrics at the Nasser hospital, was it last week, I think? And he was telling me that they ran out of baby formula, that they no longer had something called intravenous immunoglobulin that we were using to treat the many patients that were presenting with something called acute flaccid myelitis, so children that come in paralyzed for unknown reasons, but sometimes for some of the diagnoses, intravenous immunoglobulin can reverse that paralysis. Unfortunately, we no longer have the testing capabilities, the imaging capabilities, or the drugs to treat some of the things that we could diagnose if we had the diagnostic capabilities, but they'd run out of intravenous immunoglobulin, as well as multiple antibiotics since the period where I was in Gaza. So I can speak kind of just from personal experience, but perhaps MAP or MSF spokespeople can speak more generally about operations and medical supply blockade.
Thank you. Maybe Rohan, I'll go to
you. Yeah, perhaps to focus on the question about practical things that the UK can do. Hamish Faulkner, the Minister for the Middle East, obviously last week was in the House and was speaking about the sanctions that the UK had imposed on 2 Israeli ministers, an important forward step. He said in relation to question on aid that we are doing all we can to ensure that food and medicine reach children and all those in need in Gaza. And I have to say, unfortunately, I wish that was true, but it simply isn't. As we've said previously, the obligation to both legal and moral to respond to a situation of mass atrocities, extermination, starvation as a weapon of war, and as has been concluded by human rights experts and groups, genocide, means that the UK should have reviewed all relations in light of that. And there are a few things that I think, and that we as MAP think that should have been imposed long ago. First and foremost, It'll be no surprise, we've been calling it for more than a year, an immediate arms embargo on Israel and a suspension of military cooperation. In particular, a suspension of the provision of F-35 parts amongst the most lethal equipment that's used by Israel to kill men, women and children. Secondly, supporting meaningful accountability for all violations of international law. Those responsible for starving people, for ethnically cleansing people and from bombing Gaza out of existence should know that there will be consequences for that. Thirdly, using all available means to enforce a ceasefire and ensure aid can flow around Gaza safely. And failure to comply with the ICJ's provisional measures earlier, as I said, should be met with meaningful and impactful countermeasures, diplomatic, economic levers and others. And also the UK's basis, its legal basis should be a little bit clearer. We've been waiting for nearly a year now for the UK to publish its response to the ICJ's advisory opinion on the legality of the occupation. Now, that advisory opinion concluded that the court considers the duty of distinguishing dealings with Israel between its own territory and the occupied Palestinian territory encompasses, inter alia, that third states must take steps to prevent trade or investment relations that assist the maintenance of an illegal situation created by Israel in the occupied Palestinian territory. It's pretty clear, but we're still waiting for the response to this. So across the board, there are practical things that the government could do. And I should just briefly say that though there have been important steps, they are not digging deeply enough into the policy toolkit. So it did resume funding for UNRWA, very welcome, but has done nothing to meaningfully hold to account those people responsible for killing UNRWA staff in their literal hundreds. It has stated its support for international law and increased the strength of its rhetoric. However, as I mentioned, it hasn't published its response to the ICJ advisory opinion. It has suspended some 30 arms exports, comprising less than 10% of the total exports, but F-35 parts continue to flow. It has imposed sanctions on some settler leaders and, of course, 2 ministers for extremist rhetoric, but continues to allow the import of goods from illegal settlements into the UK and allows UK companies to do business in those settlements. So what we're asking for is to dig far deeper into that policy toolkit, as the UK has rightly done in other situations of severe violations of international law, including, of course, Russia's actions in Ukraine, and take seriously the warnings of atrocities that we and every other reasoned observer on the ground are making.
Thank you.
Perhaps I could complete the contribution of Dr. Hassan from her personal experience and expand it to the macro experience in terms of what is going to be the consequence if the actual blockade is not lifted. The simple answer is that the quality and the quantity of care provided will dwindle and stop. We are already the level of care being provided either in terms of quantity, in the terms of the number of beds available, the number of specialists or general practitioners available, the number of structures available proportional to the number of population, is already subpar by a long way. We are talking essentially about 6 hospitals which are providing anything near a level of function that is needed for the local population. And that's quite an exemption. That we would not normally regard these hospitals as acting up to standard, but compared to the average, they are in the forefront. We are already, as Dr. Hassan referred to, at sort of critical pre-rupture levels for some key things, including abdominal compresses. They're quite useful if you're doing war surgery. That's what's going to stop your bleeding and enable people to actually have life-threatening wounds treated. We are limited on the number of external fixator kits. That's what you need when you've got lower limb injuries by gunshot and you're doing orthopedic surgery and you want to stabilize it. It's also what you need if you want to limit and to a minimum the number of interventions that, for example, a pediatric patient is going to need over the course of their lifetime. If those wounds are not treated as best they can at the beginning, you are simply adding on 10 or 20 years worth of procedures over their lifetime because they were not handled at the beginning. We're already not able to do that. So we are, I would say, weeks away from having to make choices about the quality of care. So that means using second, third or fourth line choices instead of first line choices. We're already making second line choices, let's be very clear. And then we're going to have to make the choice to stop providing care because there won't be any care that you can provide. We won't be able to make reasoned diagnostics. We will not be able to take in charge what we have been able to diagnose. We will not be able to maintain a course of treatment for either acute or chronic injury or disease. That is the consequence.